Welcome back, Scott here with Surf & Shore. Today we are going to go through a progressive overload. This is going to be really good for tendons, whether that is elbow, knee, Achilles, biceps. All of these is more of a framework in order to try and heal up those tendons. We're going to go through how to do it with the Achilles, one of the more common ones that I see between that and the patellar tendons, quad tendons, one of those. We'll go through a little bit of those too, but the big goal with all of this is that we're doing eccentric movements. We're really trying to control that lowering phase as we go down. That lowering phase is where we get most of our muscle activation and we can get the most tendon force. If we can get more tendon force, that means the tendon has to reorganize and get back to where it needs to be in order for you to do all the things you want to do. So, starting off, level 1 is just being able to control the down. I like having, especially for the Achilles, a little bit of balance help. It's not a balance exercise. We're really trying to focus on that strength and tendon. So we're going to go up, have that nice weight shift over, lifting up the leg. That slow lowering, that slow negative on the way down, going through there. Big thing is that I don't want to see kind of that ratchety, that jumping as you kind of go down, where you kind of have those kind of quick descends, kind of like Tower of Terror, where you just drop all of a sudden. I want everything to be nice and smooth, so really make sure that it's nice and smooth. Once everything's smooth, good to go on that one, then you can progress to the next level. Next level is going to be just adding weight. Same thing, a little bit of balance, up, nice shift over. Really try and make sure you get that hold at the top too. I don't want you to lift up that other foot and have that drop initially as well. So all the way up, that full range of motion, shifting over, that slow lower down. Slowly lowering down should be anywhere from 3 to 5 seconds depending on the body part, depending on how far you have to move. If you're looking at something like bicep, same thing, I just want that nice, slow lowering. Next phase, as you increase weight, the goal is progressive overload. So if we're overloading, I want it to get to the point where it is heavy enough to where if you were to go single leg and you were trying to contract, you would not be able to go through full range of motion. So if I grab heavier kettlebell, I'm coming up on one leg, I'm having a hard time getting up with that weight. That's where I want to be. That means that we are overloading that tendon in order to really make sure that it recovers and regenerates the way I want it to. So up, weight shift over, nice and slow lower on the way down. Should be hard, should be challenging, especially once you start getting up in weight. You're looking for like a 5 sets of 3 to 5. So you're not looking for these really high rep movements. You are looking for that strength, tendon stress. So, kind of went through what it would look like with bicep. Definitely went through what it would look like with Achilles. If we are looking at quad tendon, having a box object, something like that behind you, you can use rig, something, just a toe touch, but you're just going to go down. You're almost doing single leg pistol, but same thing, just the negative. So you're going to be going down, touch, sitting down, both legs are going to come back up. Okay? Goal again is we want to get the weight to be heavy to the point where we are able to regenerate the tendon, get everything back to where we need to be. Try out the program. It takes a while. It's not something that's going to happen overnight. You're looking at a couple weeks in order for the progressions to happen, but it's worth taking the time to make sure that you fix the problem so it doesn't keep coming back. Try those progressions out. If you have any tendon issues, enjoy.